The United Nations in Zimbabwe says that $85 million is needed urgently to support the country's national COVID-19 response plan. The funding would be distributed to UN agencies and NGOs who would provide water supply, risk interventions, as well as infection control and prevention programs. The country experiences severe water shortages, even in major cities, and the healthcare system is crippled. The programs would assist to support government's limited capacity.
It's important to remember that the appeal for COVID-19 comes as part of a broader appeal, the 2020 Humanitarian Response Plan, which was launched at the beginning of April with the government of Zimbabwe, and which is for a total value of 715 million. And it is important, as we focus on COVID-19, that we don't forget the protection of those most vulnerable, and that the needs in terms of food security, in terms of livelihoods, in terms of education, in terms of protection continue and are in fact exacerbated by the impact of the pandemic.
A big blow to Zimbabwe's campaign for fundraising is that it's currently not eligible for financial support from the International Monetary Fund. The country doesn't have any debt owing to the financial body, but needs to meet other requirements before becoming eligible for assistance.
Zimbabwe would need to clear its arrears with other financial institutions, as well as reach an understanding with its bilateral creditors over clearance of arrears to them. And beyond the issue of arrears, consideration of any future request would require Zimbabwe to be ready to implement strong macro policies and structural reforms.
With the country still under sanction and the economy brought to a near standstill, the urgency for financial aid is now paramount. Ribeiro says government and agency partnerships are key in addressing the crisis.
The COVID-19 response is not just an all-society, it's an all-society response, it's an all-government response, it's an all-UN response. It really falls on the responsibility of each of us, and therefore we need to step up to the march and also be aware that it's while we are trying to contain the virus and to be able to respond in terms of care and treatment for those who are infected by the virus, it's very important for countries, and the UN supports that, to keep their eye on the economic and social situation, so that the country, and we very much hope for Zimbabwe, that it'll be an opportunity for Zimbabwe to recover stronger and better.
Zimbabwe has so far managed to keep a low infection rate. Only 34 cases have been confirmed, with 4 of those resulting in death. However, there are fears that if there's a surge, the poor nation will crumble without funding. Noma, Bolani, SABC News.